All right. So thank you so much, Dr. Kahn, for that very informative presentation. There's definitely a lot to talk about that I guess goes against a lot of the gospel that is in the plant-based community. So what I want to do real quickly, and just correct me if I'm wrong, you have about 15 minutes for Q&A. Is that correct, Dr. Kahn?
That'd be great.
Okay. So I just want to go over a few things for the audience with regard to how to ask questions. We don't take questions directly from chat. What we do is we ask you to raise your hand. And if you don't know how to do that in Zoom, the second button from the right is reactions. Click on that. You click on the raise hand function. When I call on you, just state where you're from and ask your question. And we just ask the questions are brief and on topic. And with that, I'm gonna throw the first question to the audience. So Sophia, where are you from, and what's your question?
Hi, thank you so much. I'm Sophia from Canada. My question, please, is that I am on a plant-based diet and would like to know how to lower blood pressure and avoid clots. My aunt died of blood clotting, and I would like to avoid it. Thank you so much, Doctor.
All right. Well, thank you. And in fact, plant-based diets are clearly the best diet for maintaining a normal blood pressure through life. A lot of that is because it's the diet most associated with maintaining healthy arteries, healthy endothelium, avoiding arterial stiffness, calcification, and aging of your arteries. So it fits in perfectly with the topic I talked about. Of course, if one ate a suboptimal diet for 60 years and has just transitioned, it's going to take longer to see all the benefits, although the endothelium does respond rather quickly to transitioning to a whole food, plant-based, colorful diet. There are certain foods that are optimal for high blood pressure. The leafy greens, chewed, steamed, balsamic, other vinegars are just magical. Vinegars on food to help monitor your blood sugar spikes and help your endothelium. Hibiscus tea, we often bring up, beets, things that may improve our ability to make nitric oxide in our arteries. Pine nuts are good. Watermelon, give a shout out to watermelon for blood pressure control. And generally, it's the best. There just was a review article on this topic. I wrote about it yesterday on my clinic website, which is KahnLongevityCenter.com. I'll put that in the chat. I just wrote an article yesterday about this new summary that really takes it to the science that the best diet for maintaining a normal blood pressure or reversing previous blood pressure problems is a whole food plant-based diet. Spices are great. I just would avoid salt or at least minimize salt. And then in terms of blood clotting, I mean, talking as a doctor now, not just a nutritional oriented one, there are genetic reasons for excessive blood clotting. And if you've got a significant history of blood clotting, you should talk to your doctor about a blood clotting panel that he probably could code and do it appropriately through your insurance coverage. You're in Canada, so I guess it's governmental health coverage. But there's something called factor 5, Leiden, and factor 2, and protein C and protein S, and anticardiolipin antibodies, and the whole range. You probably should get a clotting panel because, diet is wonderful, but if you've got genetic clotting disorder, you still might have risk. Of course, if you've gotten through a good portion of your life without a blood clot, you hopefully don't have a clotting disorder. Specifically, I don't have a particular food. We talk a little bit about turmeric and ginger and omega-3 fatty acids having a bit of a blood thinning effect. I think in general, a whole food plant-based diet, lower in saturated fat, is going to be more optimal for blood thinning than a meat and saturated fat heavy diet. But the data on that's a little less clear cut.
Great. Thank you for that. Actually, just real quickly, because I didn't ask you when we started this, where can people find your books?
Actually, I did put my clinic URL in the chat, and I'll put another one. My major website is drjoelkahn.com, DRJOELKHN, and the books are there. They're all linked to that large bookseller that starts with the letter A that everybody orders from. So there's 6 books. But if you go to my websites, there's hundreds of podcasts and articles and videos that are all available and free.
Okay.
That's my clinic website, the Kahn Center for Cardiac Longevity. And there is a little button that says shop, and that will take you to the books if you want. The top button. Yeah.
If someone does everything right, they eat the whole food plant-based diet and follow your prescriptions, can they still get heart disease? And if so, what are the factors that would contribute to that?
Yeah, that's a great question. And my view as a cardiologist now for 33, 34 years, and about 7 years of training before that, is we are not bulletproof on a whole food plant-based diet. We are in the most optimal position we can be in for nutrition, but we have to obviously not smoke, needless to say. We have to fit fitness into our life. It can be small bursts or long durations. It doesn't have to be excessive. We have to get sleep. Sleep has come on board as a major measure of health, longevity, brain, and heart function. And we have to know our genetics. If you have a family history of early heart attacks, a whole food plant-based diet is exactly what you should pick, but you should get tested. Just like the other question about the genetics of clotting. You should know your inflammation panel in detail. You should know your lipoprotein little a. The last book I wrote is called Lipoprotein little a, the heart's silent killer. A little blood test that even if you're on a whole food plant-based diet, you can develop plaque and heart attacks and stents and die. And I've seen that. And it's a powerful factor in some people. Homocysteine is a genetic derived component that can be elevated despite a whole food plant-based diet because of genetics. I'm very routinely checking genetic panels on my patients. It's an advanced clinic I run. And it's really interesting how some of us are unfortunately born the gene ApoE4. The best diet is whole food plant-based, but it still is going to raise your risk of coronary heart disease and of early memory issues. So we have to modify things and test things and monitor things. So I more knowledge, more power.
And you mentioned calcium scores during your presentation. Is calcified plaque, can that cause a heart attack?
It's less prone to, but it's not completely innocent. How do we know that? There have been published studies in a few hundred patients where their plaque has been measured and characterized by those CT scans. And we know which spot is calcified, heavily calcified. We know which spot is soft, non-calcified. In follow-up, if a heart attack occurs or if a stent needs to be placed, it's more commonly in the segment that's non-calcified. In fact, there's something called, this is a technical term, the 1000K plaque, a very dense calcified plaque. They seem to be safe and stable, even though they keep showing up on those calcium scores. So it's abnormal, but it's of lower risk than that soft, more immature, unstable plaque.